Hi ladies. Um, I was coming on here today to do a video since I didn't do one yesterday. Today I am 13 weeks, 1 day. So according to some sites, I'm in the second trimester, so that's good. I'm laying down, a little bit dizzy. Um, the last couple weeks have been going good. Um, The last appointment I went to, I was at where was I? 12 weeks, and we got to see the baby. I showed some of you ladies on our Facebook page already the pictures. Um, it actually looks like a baby now. I tried to see if I could tell what it was, but it's too. You can't tell. But let's see if I can show you on here. It's too bright. Here you go. You can see it a little bit, baby. And then there was another one with the baby stuck in his thumb, or what it looks like. Let's see. Yeah, but um, how has the last week or so been since the last time I made a video? Um, our appointment we did, they told me at the appointment that um everything looked good as far as the measurements, the neck measurements, and all that stuff they do. Um, for the most part, they said everything was fine. I had only gained 1 pound um, since well, since they've been tracking, not the RE office, but the actual OBGYN. They said I only gained a pound since the last time I was there. So the other thing I want to talk to you guys about was this morning they called me and said we need for you to come in. The doctor wants you to come back in um, to redo some tests because we had some blood work. Because the blood work we had came back inconclusive. So I'm like, is everything okay? I, um, I can't say good or bad. It's just that we need to redo it. So she had me come in. The call was like at 11. Had me come in at 2:30. I went in, and when I went to the back, the nurse lady, she was like, "Are you here for a consultation?" I'm like, "You guys called me." And I told her what the lady said on the phone. She was like, "Well, all I see is a consultation, so I go check." Killed the check. Came back and said, "Yeah, it's just a consultation." So she just took my weight. Um, I was down a pound. Blood pressure. That's it. And took me back to the doctor. I waited about 20 minutes, and the doctor came in, and he was like, you know, coming to me is like going to the principal's office. You always think it's something bad or something like that. And so he said that my he basically said that this appointment was just to do was a review of the stuff that you did last time. He didn't say anything about having to retest and all this other stuff. But anyways, I was confused about why that lady called and said it the way she said it. He told me that I came back immune to a couple of things like chicken pox because I already had it, measles, and stuff like just a list of stuff. But he said the I guess I don't know if it was a scan. I'm thinking think it was a scan. I can't remember, but he said it came back at 1 in 44. So, and he was like, yeah, it's only 2% chance, of 44 women, one of them would have a baby with Down syndrome. So I was like, okay. And he looked through my files or whatever. And he was like, it shows that they took a panorama test last time, but I don't see back on the 21st of last month, but it shows that it was done, but it's not listed as one of the tests where all the other stuff was listed. So he was confused if it was actually done or not. In the end, it wasn't done, so I ended up having to give blood to have a panorama test done. Results should be back in about 2 weeks. At about 15 weeks, I guess. I have an appointment at 16 weeks. And they also said if I wanted to know if it was a boy and girl with that test, because it will let you know. And I said, yeah, I want to know. Instead of having to wait 20 weeks, because I'm just anxious to buy stuff. So I was like, sure, you can tell me. So she said, when they call and give me the results of the test, that they'll let me know that too. So, yeah. Also, he told me that he's like, looks like you had well, he called it a pee infection, UTI. I'm like, UTI? When? He was like, back the last time you came, they didn't tell you? I'm like, no. They didn't prescribe you anything? No. Then nobody said anything about a urinary tract infection. Like, nobody mentioned that to me. So he's like, well, that was like 2 weeks ago. It's probably gone now. But, we'll, take your sample, your urine sample today and get it tested and find out. And if you still have it, then I'll get you a prescription. You would think that that would be something they would have told me last time I was at the doctor's office. I've never known myself to have a UTI, but I know you're more prone to get those when you're pregnant. So yeah. What else? Yeah, that appointment today, that call itself kind of freaked me out a little bit. I was confused. I got worried. I'm like, she said your blood test, like basically like something was wrong with my blood test, and I'm like, what the hell is wrong with my blood? But yeah. What else? Symptom. Well, I'm dizzy right now because they took the blood, and I woke up this morning and I didn't want like cereal or nothing like that. I didn't want anything sweet. I didn't want eggs or anything like that. So I opened up a can of clam chowder, a brand I've never tasted before. I ate a little bit of that, but it got nasty, so I gave it to my daughter. She ate it. And so I hadn't eaten anything when I went in there. And they was drawing blood, and she was having issues drawing the blood because she said my vein, it started out going, the blood started out going quickly, then it stopped, so it took her a while, and she had to do like 3 vials. Yeah, so, what else? I got something to eat afterwards, a Jimmy John sandwich. And so my headache, not headache, it's not really a headache, it's just like a little funky feeling, dizzy feeling. It's about going away. I've been laying here for a minute. Um, Symptoms, what was it? Yesterday? No, day before yesterday. Day before yesterday? Maybe I still got the UTI. I need to look up like what symptoms do you get, because I know the day before yesterday, that night, I woke up like 4 times in 1 hour to go pee. I'm like, what the hell? What the heck? Like, why I could keep doing this? It was crazy. It was like I kept. I don't know. Hopefully they'll let me know so I can take whatever I need to take to get rid of it. Um, I haven't really had any nausea. Not really. Sometimes I have a faint, deep down feeling like I don't want to do too much so that I won't get nauseous. Excuse me, I gotta pull my camera up so that I can sit up. Oh, but yeah, and also I've noticed dark spots. I already mentioned that before, but I've been getting them more, and I got it on my neck. I don't know if you can see it, but like it's like dark. You see this line going all the way across, like this way, like that. Normally not there. Man, and I'm out of breath for nothing. I haven't even done anything, but yeah, just talking gets me out of breath. I need to take my hair down, do something with it. Just don't feel like doing it. Other symptoms. I've been taking naps more frequently. What else? That's about it. It's go. I'm still. I don't know. I've been before the call today. I've been thinking I've been doing pretty good. Pregnancy's been going okay, other than spotting stuff like that. Not now, but back when I was having it. And now I'm probably gonna Google some stuff about this 1 in 44 thing, which is probably gonna stress me out a little bit. But yeah, I mean, I have people in my family that have Down syndrome. I know of two people. My mom's sister, my younger sister has it, and I have like my grandma has a sister, which is my great aunt, who has a daughter who has who has a daughter that has Down syndrome. Those are the only two I know about. And I'm very interested to see what that test come back and says. Other than that, oh yeah, I told you ladies, the person that put in an offer for our house backed out. So most likely, especially if we don't get a offer by the 22nd of this month, our contract with our builder for the house we were supposed to get, because it was in lieu of us getting our place on the contract and sold. Most likely that's going to fall through and our deposit's going to be taken. That whole situation is another video for some other time. But just want to give you guys an update, let you know what's going on. And I don't want the video to be too long because I'm just rambling and I'm getting out of breath. So I will talk to you ladies later. Bye.